Hi everyone, good morning and best greetings to all of you. How is everyone doing today? Hopefully we are all always in good health. Welcome to the International Webinar Collaboration, Sema Ff-Kmup and Cyberjaya University Pharmacy Student Society. It is an honor for us to be your Masters of Ceremony on this sunny morning and at this wonderful event. I'm Soraya and
me, Adiva Stephanie,
will be your MC for today.
Honorable Chef Committee of International Webinar Collaboration, Sema Ff-Kmup and Cyberjaya University Pharmacy Student Society, Ms. Feni Elvina Fidelia, Chairwoman of Sema Ff-Kmup, Ms. Hana Afifah, Chairman of BPM Ff-Kmup, Mr. Alan Wijaya Kusuma, President of Cyberjaya University Pharmacy Student Society, Muhammad Najmi Alif, Dean of Faculty of Pharmacy, Cyberjaya University, Professor Datin Dr. Rosnani Binti Hashim, and last but not least, Dean of Faculty of Pharmacy, Pancasila University, Professor Dr. Apotekar Shamsuddin, Master of Biomedical Science. And we are proud of all of the participants who have attended the International Webinar Collaboration, Sema Ff-Kmup and Cyberjaya University today.
First of all, before we start our agenda today, you may express your praise and gratitude to the God Almighty. Because of His mercy and permission, we can gather on this sunny morning and at this wonderful event without any obstruction and in good condition. Ladies and gentlemen, on behalf of the Committee of International Webinar Collaboration, Sema Ff-Kmup and Cyberjaya University Pharmacy Student Society, we would like to extend the warmest welcome to all participants and invited guests who have taken the time to present their materials today. Before we start, we will read out the rules of conduct while undergoing the event, and all participants are required to follow and obey the rules so that the event runs smoothly. First, the first rule would be participants are allowed to join Zoom 15 minutes before the event starts at 8:45 waktu Indonesian Barat for Indonesian participants and at 9:45 Malaysian time for Malaysian participants. Rule number 2, participants re-registration starts at 9 till 9:15 waktu Indonesian Barat for Indonesian participants and at 10 to 10:15 Malaysian time for Malaysian participants. Participants are not allowed to share the webinar link that will be delivered by the committee through Zoom chat to the non-participants. Rule number 4, participants are expected to rename before joining Zoom with the following format: number_name_institution. For an example of Ff-Kmup participants, 01_Maulida Salsabila _Universitas Pancasila. An example for non-Ff-Kmup participants would be 01_Maulida Salsabila _institution or others. Example of UOC participants is 01_Maulida Salsabila _UOC. The name used is the same as the registration name given. Rule number 5, participants are required to fill in the first, second, and third attendance form via the Google form, which will be distributed by the committee via the Zoom chat column. The attendance list is only open for 15 minutes. Rule number 6, participants are required to turn on the camera throughout the event. Rule number 7, participants are required to wear neat and polite clothing. Rule number 8, participants are expected to mute during the event. And rule number 9, participants who want to ask questions or comment can go through the Zoom chat column in the format name_speaker102_question and must use good and polite language without containing elements of discrimination or racism. Questions will be answered at the end of each session. Rule number 10, during breaks, participants are expected to turn off the camera and not leave the Zoom room. Rule number 11 is during the Cultural Odyssey event, participants are expected to use good and polite language without containing elements of discrimination or racism. Rule number 12 is All participants are expected to not leave the Zoom before the event is over. And rule number 13 is the term and conditions for obtaining a certificate are as follows. First, participants have to fill out the first, second, and third attendance list at the time of the event. And second would be participants attended the whole webinar from the beginning to the end of the event.
Baik, saya akan membacakan tata tertib webinar internasional. 1. Peserta diperkenankan bergabung di ruang Zoom 15 menit sebelum acara dimulai pada pukul 8.45 waktu Indonesia Barat bagi peserta Indonesia dan pada pukul 9.45 Malaysia Time bagi peserta Malaysia. Nomor 2, peserta diharapkan mengisi registrasi ulang pada pukul 9 sampai 9.15 waktu Indonesia Barat bagi peserta Indonesia dan pada pukul 10 sampai 10.15 Malaysia Time bagi peserta Malaysia. Nomor 3, peserta dilarang menyebarluaskan link webinar yang akan disampaikan oleh panitia melalui chat Zoom kepada yang bukan peserta. Nomor 4, peserta diharapkan merename terlebih dahulu sebelum bergabung di Zoom dengan format nomor _ nama _ institusi. Contoh bagi peserta Ff-Kmup 01 Maulida Salsabila Universitas Pancasila. Bagi peserta non-Ff-Kmup 01 Maulida Salsabila institusi atau umum. Untuk peserta UOC 01 Maulida Salsabila UOC. Nama yang digunakan sama dengan nama saat melakukan registrasi. Nomor 5, peserta diwajibkan untuk mengisi daftar hadir pertama, kedua, dan ketiga melalui Google Form yang akan dibagikan oleh panitia melalui kolom chat Zoom. Pengisian daftar hadir hanya dibuka selama 15 menit. Nomor 6, peserta diwajibkan untuk menyalakan kamera sepanjangnya berlangsung acara. Nomor 7, peserta diwajibkan untuk memakai pakaian yang rapih dan sopan. Nomor 8, peserta diharapkan untuk mematikan suara selama acara berlangsung. Nomor 9, bagi peserta yang ingin mengajukan pertanyaan atau berkomentar dapat melalui kolom chat Zoom dengan format nama _ pembicara 1 atau 2 _ pertanyaan dan wajib menggunakan tata bahasa yang baik dan sopan tanpa mengandung unsur sara. Pertanyaan akan dijawab di akhir tiap sesi. Nomor 10, pada waktu istirahat, peserta diharapkan untuk mematikan kamera dan tidak meninggalkan ruang Zoom. Nomor 11, pada saat acara Cultural Odyssey, peserta diharapkan menggunakan tata bahasa yang baik dan sopan tanpa mengandung unsur sara. Nomor 12, seluruh peserta diharapkan untuk tidak meninggalkan Zoom sebelum acara selesai. Nomor 13, syarat dan ketentuan untuk mendapatkan sertifikat adalah sebagai berikut. A. Peserta telah mengisi daftar hadir pertama, kedua, dan ketiga pada saat acara, dan B. Peserta telah mengikuti webinar dari awal hingga akhir.
Before we start our wonderful event, I would like to tell you guys the sequence of our agenda. First, we will have our opening remarks. Second, we will provide souvenirs from the International Webinar Committee Sema Ff-Kmup. Third, we will go with the first material titled Self-Care in the Context of Primary Healthcare. And we will then go forth with the second material of the day, is Beyond the Counter, Unleashing the Full Potential of Pharmacists in Healthcare. Afterwards, we will go with the discussion and question session. After we finish those, we will provide souvenirs to the presenters. And lastly, before our break time, we will have a video presentation from both Sema Ff-Kmup and Cyberjaya University Pharmacy Student Society. Then we will have our break. After break, come back. So we will have our Cultural Odyssey event. And we will continue with the games and close with a photography session together.
Ladies and gentlemen, the first agenda is opening remarks, which will be presented by Chef Committee of International Webinar Collaboration, Sema Ff-Kmup and Cyberjaya University, Ms. Feni Elvina Fidelia.
Hey, good morning, ladies and gentlemen. I'm the Honorable Prof. Dr. Apete Shamsuddin M. Biomed as the Dean of Faculty of Pharmacy, along with his staff, the Honorable Prof. Dr. Datin Rosani Binti Hashim as a Dean of Faculty of Pharmacy, Cyberjaya University, along with her staff, the Honorable for Mr. Alan Wijaya Kusuma as a Chairman of BPM Ff-Kmup, along with his staff, the Honorable for Ms. Hana Afifah as a Chairwoman of Sema Ff-Kmup, along with her staff, that I love the committee and friends who have attended this event. Welcome to our esteemed international webinar on self-medication, the pharmacist's role in healing society. As the chief committee of this event, I'm truly honored to have you all gathered here today. In an era where health and well-being are paramount, the concept of self-medication plays a significant role. Today, we will delve in the complexity surrounding the self-medication practice and, more importantly, explore pharmacists' pivotal role in ensuring safe and informed choices. Our panel of distinguished experts and participants worldwide promise engaging insight and thought-provoking discussion. Together, we aim to show how the pharmacist's expertise can guide individuals in making responsible healthcare decisions. I certainly appreciate our esteemed speaker for sharing their knowledge and experience. Your expertise will undoubtedly enrich our understanding of this critical subject. To our participants, thank you for joining us on this journey and exploration and enlightenment. Your presence underscore the importance of collaborating effort in shaping a healthier society. Let us engage in friendly discussion, share ideas, and glean valuable insight to empower ourselves and others in self-medication. Thank you for being a part of the Meaningful in Denver. Thank you.
Thank you so much, Ms. Penny Elfina Fidelia, for those wonderful remarks.
For the next opening remarks, it will be presented by President of Cyberjaya University Pharmacy Student Society, Mr. Muhammad Najmi Alif.
All right. Thank you, MC. Assalamualaikum warahmatullahi wabarakatuh and good morning. I bid to Dean of Fakultas Farmasi Pancasila University, Prof. Dr. Apataka Shamsuddin, Dean of Fakultas Farmasi University of Cyberjaya, Prof. Dr. Rosnani Hashim, Chairman of BPM Ff-Kmup, Mr. Alan Wijaya Kusuma, Chairwoman of Sema Ff-Kmup, Ms. Hana Afifah, our Chief Committee, Ms. Fanny Elvina Fildea, to our respected speakers, and to all participants for today. Welcome everyone to our international webinar, collaboration of Sema Ff-Kmup and CUPS for today. First of all, I would like to congratulate all of the committee for efforts and dedication for making this event. A special thank you to our Chief Committee, Ms. Fanny, for inviting us, Cyberjaya University Pharmacy Student Society, for having this collaboration. And to all participants for today, thank you for spending your time for today's session, even though we realize that most of you are in your semester break. So we really appreciate your presence for today. I wish that all of you may learn and gain something from today's webinar, most importantly about what self-medication really is. Because when we talk about self-medication, of course, people may have their own interpretation depending on the practice of each person. So I hope that this event may deepen your understanding more, and I hope you enjoy every single session for today. So that's all from me. Then I will be passing back this floor to our MC for today. Thank you.
Thank you, Mr. Muhammad Najmi Alif, for those inspiring words. Hopefully everyone will get to learn something.
For the next opening remarks will be presented by Chairwoman of Sema Ff-Kmup, Ms. Hana Afifah.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Thank you to each and every one of you for being here today at this wonderful day. In advance, I respect the Dean of the Faculty of Pharmacy, Pancasila University, Professor Dr. Apoteker Shamsuddin M. Biomed, and respect Dean of the Faculty Farmasi, Cyberjaya University, Professor Datin Dr. Rosnani Binti Hashim, and respect the President of Cyberjaya University Pharmacy Student Society, Muhammad Najmi Alif. I respect Mr. Alan Wijaya Kusuma as the chairman of the BPM Ff-Kmup and staff. And I respect Ms. Fanny Alvina as the chief executive of the international webinar event and all the committees that have organized that event today. First of all, praise and gratitude we go to God Almighty. Because of His blessing, we are still given the opportunity and how to organize an international webinar with Cyberjaya University Pharmacy Student Society 2023 online today. Webinar International in collaboration with Sema Ff-Kmup and Cyberjaya University Pharmacy Student Society is an event that aims to introduce and deepen understanding of the pharmaceutical fields to students and academics from both institutions. This event is expected to discuss topics related to the latest developments in pharmaceutical science, the use of technology in the pharmaceutical industry, as well as important issues such as drug control and other global health issues. And I hopefully today's event can run smoothly until the end of the event later. So did I thank you from me. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Ms. Hana Afifa, for those wonderful remarks.
For the next opening remarks, we will call out Mr. Chairman of BPM Ff-Kmup, Mr. Alan Wijaya Kusuma.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It's great pleasure for me to welcome you to the international webinar in collaboration of Sema Ff-Kmup x Cyberjaya University Pharmacy Student Society. I am very thankful to you, the Honorable Dean of Faculty of Farmasi Pancasila University, Professor Dr. Apoteker Syamsuddin, Magister Biomed, the Dean of Faculty of Farmasi Cyberjaya University, Professor Datin Dr. Rusnani Binti Hashim, the Chairwoman of Sema Ff-Kmup, Ms. Hana Afifa, the President of Cyberjaya University Pharmacy Student Society, Mr. Muhammad Najmi Alif, and Head of the Webinar International Committee, Ms. Fanny Alvina Fidelia, for taking time out of your busy schedule to attend this event. I also wish to thank the committee for this who have organized this wonderful event. I wouldn't like to take too much time, so I will hand it over to our MCs again to proceed to the next agenda. Once again, welcome and thank you very much for attending this event. I wish all the participants have a good time. Thank you. Assalamualaikum. Good morning.
Salam. Thank you, Mr. Alan Wijaya, for those welcoming words.
For the next opening remarks will be presented by Dean of Faculty of Pharmacy, Cyberjaya University, Professor Datin Dr. Rusnani Binti Hashim.
Thank you, MCs of ceremony. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Yang dihormati Prof. Dr. Apoteker Syamsuddin, Dean Fakultas of Farmasi Universitas Pancasila, all respected docents and lecturers. Chief Committee of Webinar International 2023, Ms. Fanny Alvina Fidelia, Ms. Hana Afifa, Mr. Alan Wijaya Kusuma, and the President of CUPS, University of Cyberjaya, Mr. Muhammad Najmi Alif. It is indeed great pleasure, and I would like to extend a warm greetings and salam sejahtera from Faculty of Pharmacy, University of Cyberjaya, Malaysia, to Honorable Host, Universitas Pancasila, Indonesia. I would like to take this opportunity to express my deepest thanks for the organizing committee for inviting me to participate in this special and historical event, Webinar International 2023, with a very, very interesting theme, self-medication and role of pharmacists in healing society. It's great to meet all in this webinar today. Ya, hikmah dari COVID kita dapat ketemu di hari yang bersejarah ini. I hope this marks the beginning of our collaboration between Sema Ff-Kmup, Fakultas Farmasi Universitas Pancasila, and KAPS University of Cyberjaya. Universitas Pancasila memang terkenal di Malaysia dan merupakan fakultas farmasi swasta yang pertama dan terbesar di Indonesia. Ya, Prof. Syamsuddin, kita serupa ya, UOC juga universiti swasta. Finally, my heartiest congratulations to the organizing committee for the excellent efforts in managing today's remarkable event. I am honestly impressed with the great initiative and hard work in making sure that this event is a great success. And I'm very confident that it will be. Lastly, we look forward to further future collaborations between Fakultas Farmasi Pancasila and Fakulty Farmasi University of Cyberjaya, inshallah. Last but not least, our best wishes to all. With that, wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Datin, Dr. Rosnani binti Hashim, for those admirable words.
Now, for the next opening remarks, it will be given by Dean of Faculty of Pharmacy, Pancasila University, Prof. Dr. Apotheker Syamsuddin of Master of Biomedical Science.
Thank you, MC Soraya Asmir. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning to all participants and also the committee. The Honorable Professor Datin Dr. Rosnani binti Hashim as Dean of Faculty of Farmasi Cyberjaya University, Malaysia. The Honorable Vice Dean Student Affairs Faculty of Farmasi Universitas Pancasila, Dr. Nimade Dwi Sandi Utami. The Honorable Hesti Utami Ramadaniati, PhD, as Head of Profession Program Apotheker, Faculty of Farmasi Universitas Pancasila, and one of the speaker international webinar. The Honorable Dr. Datin Dr. Mariani Ahmad Nizaruddin, as one of the speaker from Cyberjaya University. The Honorable lecturer, student, especially Sema Ff-Kmup and Kmup, CUPSS, Cyberjaya University Pharmacy Student Society. First of all, let us thank God, the Almighty, who has given His grace, so that the international webinar with the theme
Rob, you're muted, Rob.
innovative idea, concept, and breakthrough in the role of the pharmacist in healing society. I especially thank the organizing committee for their hard work, perseverance, and patience in preparing and organizing this webinar so that it can go well, smoothly and successfully. Finally, through his webinar, let us extend the network and cooperation between Sema, Kmup, and CUPSS. Before ending, I will read a pantun. I saw a big eagle, so I took a picture. University is a struggle to achieve the future. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Prof. Dr. Apotheker Syamsuddin. That was an amazing poem. Thank you.
For the giving handover of souvenir, we would like to invite Ms. Penny Elvina Fidelia as the Chef Committee of International Webinar Collaboration, Sema Ff-Kmup and Cyberjaya University Pharmacy Student Society to hand over the souvenirs. The first souvenir will be given to Professor Dr. Apotheker Syamsuddin, Master of Biomedical Science as the Dean of Faculty of Pharmacy, Pancasila University.
Thank you very much.
Thank you, Prof.
Allow me to take the picture. And 1, 2, 3. Thank you.
The next souvenir will be given to Professor Datin Dr. Rosnani Binti Hashim as Dean of Faculty of Pharmacy, Cyberjaya University.
Thank you so much.
Thank you so much.
Allow me to take another picture. And 1, 2, 3. Thank you.
The next souvenir will be given to Mr. Muhammad Najma Alif as the President of Cyberjaya University Pharmacy Student Society.
Thank you.
Allow me to take another picture. And 1, 2, 3. Thank you.
Thank you so much.
The next souvenir will be given to Mr. Alan Wijaya Kusuma as the Chairman of BPN Ff-Kmup.
Allow me to take another picture. And 1, 2, 3. Thank you.
And the last souvenir will be given to Ms. Hana Afifa as the Chairwoman of Sema Ff-Kmup.
Allow me to take another picture. And 1, 2, 3. Thank you.
Now, I would like to welcome Ms. Datin Dr. Marini Ahmad Izaruddin to present her material on self-care in the context of primary healthcare. For everyone listening, please focus and jot down important notes during the session. Datin Dr. Marini, you may take the floor.
Thank you very much, Ms. MC. I would first like to check if everyone can hear me clearly. Can you hear me?
Yes.
Thank you so much. I am indeed very, very honored and feel so blessed for the special invitation given by the Sema Faculty Pharmacy KMUP and also our beloved CUPS. Good morning, everyone. I am Mariani. I will be so thrilled to present in the next 30 minutes or so my lecture on self-care in the context of primary healthcare. And I would like to thank the organizing committee to help me with the selection of moving the slide. Yeah. So I'm with the community pharmacy department, and I'm also currently working with various collaborations with the Ministry of Health Pharmacy Division. So the next slide, please. Could you assist in the next slide? Thank you so much. So everyone, I'm so excited that you mentioned there will be discussion later. So please be ready to share some of your questions in the chat box or share later with our my counterpart from Indonesia that will also be talking, and we will have many questions to be answered for healthy discussion. But my topic today, my outline of the lecture will be quite briefly talking about self-care. What is self-care? And also the factors that have led to increase in self-care. I will also touch more on the self-care concept and link it later with self-medication that will be discussed with our esteemed colleague from Indonesia. And also we will talk about barriers to self-care, what are the trends, and why pharmacists are so valuable, because they are a trusted source of information, and also facilitated self-medication. And last but not least, I will leave you with some further ways to find out more about self-care. So next slide, please. So I would like to begin by trying to explain why our national healthcare systems are very similar in Malaysia and Indonesia. Well, as you know, the broadest base of health coverage or delivery of healthcare is by way of primary care. So primary care forms the base of healthcare delivery, and it involves a lot to do with the patient or the consumer. So primary care, where you have the clinic, or I think in your country, you may be referring it to some of the rumah sakit or so on. But here in Malaysia, we refer to community clinic kesihatan, yeah, or even the private community pharmacies. So primary care is the most accessible care because it is in the community. And in the secondary care and so on, it is where we see more of the hospitals and so on. So even a consumer is involved in primary care because the consumer or the patient will take action for their care. Next slide, please. So what is the self-care concept? Well, self-care is the practice of individuals looking after their own health by using the information and the knowledge that is available to them. Okay, and where does this information come from? Well, this information might be coming from many sources, but what is most important, and I leave you with this important one point to take out from this lecture, they must be having good source of information, and the decision making that they do has to be shared decision making with those that are in the know. For example, with doctors, pharmacists, and other healthcare providers. The knowledge must be from reputable sources, credible sources, and so on. So this is where we will talk later, maybe more on what is happening today, that sometimes the sources of information can be quite misleading. Next slide, please. The reasons for self-care to become more and more popular is very simple. The community and the citizens of countries have become more, I would say, higher purchasing power, become more affluent. So this is what we mean by socio-economic factors. People are beginning to have more money and able to spend in areas that they are concerned with. Another reason that self-care has become more popular is that there's just so many more products out there, yeah? And this is very concerning as well. A reason for the potential through handling your own health through self-care is also very desired by people. People generally want to be responsible for themselves. So they want to manage their own care. And that's why self-care has become so important. And in terms of the lifestyle today, we know that a lot of diseases and conditions out there, especially non-communicable diseases, they can be actually prevented or they can be improved by having more preventive care. So we have to have a healthier lifestyle, and that is why self-care has become so important, because prevention is better than cure. Taking care of one's lifestyle is very important towards having better health. This can be in the form of exercise, better nutrition, and also rest and relaxation. Okay, another reason for high self-care is because of the demographic changes and epidemiological factors such as an aging population, and actually people need to have care available to them at their convenience and very accessible. Therefore, people are visiting more and more private healthcare centers because of aging and so on. Thank you. Next slide. Another thing I like to point out that's very important as pharmacy students and pharmacists, we know that the responsibility of becoming a pharmacist in the future and also managing patients can also be a very big job. You are now entrusted with society's care. That is why you are professionals. But there has been many studies recently, even in Malaysia, where we discuss with the National Alliance for Communicable Disease, in which even the area of our own healthcare workers, we are concerned with our healthcare workers and their self-care. And we have launched a document called Improving the Care Landscape in Malaysia for Healthcare Workers and People Living with Non-Communicable Diseases. This involves a stakeholder discussion with the Malaysian Medical Association, Malaysian Pharmacy Society, because we are very, very certain that you can only care for patients and customers and consumers when your health is also in a good state. Would anyone like to raise their hand and agree with me that you must be kind to yourself before you can be kind to others? Would you like to raise your hand in the caption? Okay. Yes, if you want to be able to manage care and take care of others, you have to also engage in self-care. Another very important reason that self-care became so apparent was during the COVID-19 pandemic. Of course, with a lot of people succumbing to illness during COVID, there was also a need to take care of themselves better. And there was a lot of good practices that were learned, for example, through technology, the ability to actually find out how to use technology to their benefit, and also the need to practice screening, for example, doing
Miss Midatin, you're muted.
Yeah, the need to actually provide screening for oneself. This is all good self-care practice. So COVID-19, like mentioned earlier by our others, is also technology has made us even more in line with self-care practice. Thank you. Next slide. So let us look at what exactly has been going on for the past 25 years. Okay, when I became a pharmacist in the year 2000, I was studying my master's in healthcare management, and I was learning about the WHO Initiative for Health for All. And actually, there are 7 pillars of self-care. What are the 7 pillars of self-care? They are knowledge and health literacy. They are mental well-being. They are physical activity, healthy eating, risk avoidance, good hygiene, probably preparing in COVID-19 and infections time, yeah? And where all pharmacists will always be very much the trusted person, the rational use of products and services. This is our major role. Sometimes we know this component of self-care as self-medication, but we must also know that more and more of the public come to see us for matters concerning any area of public health. For example, addiction, for example, nutrition. So we have to be ready for the understanding the responsibility that we have now towards self-care and its components. So the most important aspect of us helping the consumer or the public is in the area of knowledge and health literacy, as well as rational use of medicines. Next slide, please. So with that in understanding, we need to know also what could the barriers be to self-care. For example, pharmacists, we know we have a lot of things to do, yeah, and as well as being a student, we have many assignments to do, but we must take heed and take seriously the concept of self-care before we can be helping others and be kind to others. So what are the barriers? Well, there are some structural and regulatory barriers. There's also the pharmacist perception. Maybe there is just too much to do, that maybe providing self-care is not their priority as a pharmacist. There is also having a need for improved health literacy, and whether the consumer wants to improve their literacy by the trusted source. There is also the workload efficiency, and whether there is an ability to complete all these things that's needed. And of course, some of the barriers may include interprofessional teamwork, because sometimes the areas overlap. For example, in the community pharmacy, people come and ask about advice on nutrition. Can we give advice as nutrition? Or do we call in our dietitians? So nowadays, even in Malaysia, we have a model of care in the community pharmacy where we are working together with nutritionists, dietitians, and even physiotherapists. So self-care requires a strong teamwork. And according to some of the other studies, sometimes because the lack of remuneration model, therefore the activity of self-care is not easily understood and documented in community pharmacies. Next slide, please. The current trend in self-care, as you would believe, it is on an uptrend, a big uptrend. The reason is because we, as a human being with more knowledge, with more education, we are improving in self-reliance. And sometimes, to the detriment, we tend to be a bit more individualistic in our approach to healthcare. There is also, of course, the business component, because self-care has affected two major areas, and that is the area of costs and, of course, consumerism. What is cost and consumerism? Well, when a person is able to afford, they will spend on their health. And another one, of course, is the fact that by doing some of self-care practice by the consumer, you are actually helping in the government's economic burden. Why? Because sometimes going to the hospital for a minor ailment or going to the doctor for something that can be managed by yourself is actually very cost effective for a nation's healthcare. So sometimes when you look at self-care, it is actually encouraged by national ministries of health. Okay, self-care is, of course, the oldest type of care. What do I mean by oldest type of care? Okay, especially your mother. Your mother has been taking care of you. It's actually self-care. That is why about 5 years ago, the Ministry of Health and the government of Malaysia said it was very important to empower women and mothers in families towards having better health literacy, because women and mothers traditionally take care of their families. They have to make sure that the children are given medicine and so on. And even before that, in our nenek moyang time, yeah, our nenek moyang would also collect herbs from their own backyard. They will have tanam certain types of plants for health. So this is actually the oldest type of healthcare. Yeah, it is the care of alternative medicine and so on. It was a concept that people really, really believed. Okay, and because it was a very because the healthcare system was very sort of Western based, and there was more and more emphasis on the roles of doctors and healthcare, medical care, people were sometimes not left to continue just providing self-care to themselves. Okay, there was a belief of a biomedical approach. Biomedical approach is basically understanding the human body and its biological system and how it relates to illness. But there is another approach that we can also take note, and this is the approach of illness behavior and health belief model. So what happens normally is when a person has a certain disease or a condition, it is not only the actual physical condition that impacts the person and their family. It is also the mental, spiritual, social well-being. And that is why cultures tend to like to respond towards a culture of self-care by using all kinds of traditional treatments alongside Western medicine. So it is very challenging in our Southeast Asia region because we have a big emphasis on both Western medicine as well as traditional medicine. So the importance is to actually ensure that the two exist in harmony. Yeah? Okay. Can you, yeah, next slide, please. Now I would like to talk about the area that we as pharmacists and you as future pharmacists really come into play. And that is in the area of facilitation and providing sources of information. Okay, I would assume most of you have gone to an apotheker, right? And most of you have seen how the pharmacist engages with the patient or the customer. 20 years, 15 years ago, maybe the pharmacist will sit at the back of the counter and wait for the patient to come in, right? But nowadays you can see the pharmacists in the community pharmacy, in the apothecary, coming out to meet the patient, coming forward to see the patient and ask, how may I help you? This is what we call an ability to gain the trust of the public, to gain the trust of the consumer, that when a consumer feels that the pharmacy is located nearby, they can go to the nearby pharmacy, they can get the appropriate care because they trust the pharmacist. And that is why I always say, every pharmacist is an influencer, correct? You can be an influencer. But this is where I actually have a conscience about what actually are we debating on TikTok. Are we doing it in real practice where we go and do this in our community pharmacy? Or are we just doing this influencing outside there in social media? Let us bring it back to the real grassroots of being an influencer at the grassroots level, at your community level, to be your wakil, to be the health wakil, to be the duta ubat. Okay, bring it back to the community pharmacy and help the patients with their minor ailments. Okay, help the patients to give them support. And one of the major area now, which is of course area of aging. As you know, more and more people are aging in society. And this is where a lot of you in the next 10 years will have to be able to work a lot of area in geriatric care and helping the community in terms of the support needed. Sometimes being a community pharmacist and recommending product and service is about having the right information to work together with other healthcare professionals. So now in community pharmacies in Malaysia, we have what we call rental scheme for equipment that is needed to be used by people. For example, if a person is asthmatic, they won't go out and buy the whole nebulizer machine. They may borrow it from the pharmacy or they may rent it. If a person needs to have suction device, they may obtain it by rental from the pharmacy. So the pharmacist is providing care not only in medication, but providing care in support of daily life. And this is very important. What does this mean to pharmacists is that actually our learning and our continuing professional learning has to be very, very ferocious. We must always look for information. We must always seek to know the latest. And that is why if you come out in the next 5 years, Even the knowledge that you have gained from university in the next 5 years has changed, and it has developed based on all the current condition and landscape. So it's important that you also empower yourself as students to know the sources of information that can be trusted. So you can always look towards your National Pharmaceutical Association for your updates. You can also look towards the FIP, which is the International Pharmaceutical Federation, because they produce valuable guidelines, valuable guidance on all kinds of latest areas of practice for pharmacists. Okay, next slide, please. And this is where you as a pharmacist will need to always update your information and your literacy, because there are many, many areas too where patients will be asking you questions. For example, when I was a pharmacist in community about 10 years ago, a patient would come in to see me and ask about cancer support. Okay, how to get more information about the cancer that the family member is experiencing. So sometimes when you are in a community pharmacy, you have to do a lot of matchmaking. You have to do some kind of support to the patient and the family, whereby the customer is asking for information. You may not be able to give direct cancer support, but you'll be able to link them up with the right support group and so on. And that is providing health literacy, not only by words, but providing them further ability for the patient and the family to gain information so that they are involved in the decision making and so on. In the United States of America, with a population of 90 million individuals, only around 36% have got enough health literacy ability. So I would imagine that like us in Malaysia now, we are working very hard to improve health literacy levels. And in Malaysia now, there are about 70% success rate in public knowing about their medicine. 70% out of over 3,000 to 4,000 people interviewed. There's about 70% success because of the Malaysian program called Duta Kenali Ubat. But there are many, many other ways in which pharmacists can improve the health literacy level by assisting and empowering individuals to understand about their health. This is where I would like to talk to you about how important some aspects of psychology are in dealing with consumers' questions. For example, as a healthcare professional, when you are approached by a member of the public and they ask you rather sensitive questions or rather or certain questions that you might find other consumers shouldn't hear, you need to bring them to a private room, okay? And what has happened now recently in Malaysia is that before a pharmacy, community pharmacy can be licensed, we are already now providing counseling rooms, okay? And this is very important because a consumer will only come to see you as a community pharmacist, come to see you because they feel safe. So our approach to patients is that we provide a conducive environment that is shame-free and where individuals can ask questions without feeling judged, okay? And a pharmacist has to then therefore use appropriate language to identify the ability and engage in health discussion. Of course, we will have more discussion afterwards for you. I hope you can ask or write in your comment box any questions that you want, and we can also look into the differences between how the self-care concept is working in Indonesia and also in Malaysia. Next slide, please. Pharmacists will therefore be the main purveyor of self-medication, facilitate the understanding of the patient for non-prescription medicine and so on, okay? But I would just like to mention, based on some of our reading, all right, that there has been a misconcept of how much a consumer should self-medicate. We cannot propagate the idea that the consumer is to demand for antibiotics or demand for certain treatment. The overall responsibility of providing care is still the doctors and pharmacists' responsibility by law. But the importance of the patient or the consumer to know their involvement in decision-making for their care is very important. The primary healthcare team members are comprised of the doctor, pharmacist, and patient as a center. So therefore, facilitated self-medication means you still have control of where medicine is sold, where is it available and not available, but you provide the necessary options for the consumer to decide. And this ultimately is a very powerful concept, the concept that you empower a patient to be responsible for their self-care because they are involved in decision-making. Okay, next slide, please. In the whole continuum of care, all right, from your birth to the day you pass away, you will always be seeking a form of healthcare. But in the early years, of course, those decisions are handled by your family. As you can see, responsibility of daily choices, you and your family, all right? In your lifestyle, it is you to make sure that you have good healthcare practices and also are able to self-manage. But when conditions along the self-care continuum, for example, lead in from minor ailments lead into long-term conditions, you then have to ensure that you also seek proper care, you know, continue to take your blood pressure medicine, but still seek care for screening, for monitoring of your medicines and so on. And this is where, if you notice the continuum of care, there is a large aspect actually involving your own preventive care and leading up to needing help in other professional areas, for example, professional doctors and so on. So there's actually a lot of care that people can access at community level. Okay, next slide, please. This is the handbook that I would like to share with you. It is called the Empowering Self-Care Handbook. Sometimes as community pharmacists, we have and pharmacy students, we must know where are some of the trusted sources of information. And the good thing about FIP is also because of my involvement with FIP, they do handle a very multicultural, multinational approach. So whenever guidelines are developed along areas of importance, there is always a localized flavor to it. In other words, the strategies can be conceptualized for everyone to understand, but they have to work in your own local setting. So, so far, this has been a very strong component of care by FIP, and that is for pharmacists to be the self-care advisor, yeah, or advocate for self-care. All right, and the next slide. I would like to thank the organizers again for the gracious invitation, and I'm very, very blessed to have been able to see you all today. Okay, I hope you have many questions later. Thank you.
Thank you so much, Dr. Mariani, for the amazing material that has been presented. We would like to do the discussion session after the second material. So for all participants who would like to ask our speakers, please write down your question in the Q&A box with the format name _ speaker 102 _ question.
Now, let's move on to the second material, Beyond the Counter, Unleashing the Full Potential of Pharmacists in Healthcare, that will be presented by Mrs. Apotheker Hesti Utami Ramadaniati, Master of Clinical Pharmacology, PhD. Time and place are welcome.
Okay, thank you, Committee. I will be happy if I can share by myself, if possible. Hello, Committee. Yeah, thank you. Okay. Am I sharing now?
Yes.
Okay, thank you.
Yes.
Okay, good morning, all lecturers, researcher, and students from Saberjaya University and Universitas Pancasila, and all participants. I'm Hesti Utami from Universitas Pancasila. It is an honor for me to be given the opportunity to share my talk about maximizing role of pharmacists in primary care setting, especially during recovery stage after pandemic. Okay, these are the outline of my talk this morning. I will start with brief overview about primary healthcare system in Indonesia. Then we will look at the regulation to standardize the pharmaceutical service in primary care. We also discuss the existing role of primary care pharmacies and the possible direction of pharmacies in the future. Okay, as we know that Indonesia has a geographically complex nation made up of estimated 17,000 islands. It is the fourth most populated country globally, and our country faces the unique challenge of providing healthcare across more than 1,000 islands and 34 provinces with a mix of public and private providers. So we look at the history in the 1960s, recognizing the need to provide better health service to our communities. Indonesia introduced Puskesmas into the primary healthcare system. Puskesmas stand for Pusat Kesehatan Masyarakat, government-owned community health centers that still function today to target primary healthcare gaps, including primary care delivery and population health management. So over the next 50 years, Indonesia has faced challenge within its primary health system, but has been able to adapt and to respond to all the challenge while maintaining service delivery through the Puskesmas network as a major source of primary care. As you can see here, that seeking to improve geographic access across the country, island, the level of care extended to include Pustus or auxiliary Puskesmas, and also Pusling is mobile Puskesmas using vehicle or boat, and community outreach posts that including Poskesdes is village health post that providing basic maternal and children health care, health promotion, and then we also have Polindes. It is the village midwife post to provide service for the delivery or labor for villagers, and we also have here. Let me check it. Posyandu, it is integrated health post providing basic service for mother, children, and immunization, providing nutrition and other simple things or basic service. So the Puskesmas network here provides 6 essential services. The first one is health promotions. Second one is communicable disease control. The third one, ambulatory care, and also maternal and child health and family planning. The fifth one is community nutrition, and the last one is environmental health. And for your information, that 1/3 of Puskesmas also provide basic inpatient care, such as basic emergency obstetric and neonatal care. And on the other side, the private sector is very large and diverse. It includes not-for-profit, either faith-based or NGO-based, and also for-profit private practice, clinics, hospital, and practitioner of traditional medicine. And in 2014, our government introduced a new health insurance system called JKN, Jaminan Kesehatan Nasional, to increase access to care and also to move towards universal health coverage. And under this scheme, Indonesian citizens who pay the monthly premium or those who are eligible for exemption are entitled to receiving care and essential medicine at public health facilities, and also from private providers who are working or affiliating with JKN, including community pharmacies, clinics, and general practitioner. And for your information, as of March 2023, JKN covered just over 90%, is roughly around 252 million members, making our JKN the largest single payer system in the world. Okay, next we will find out the rationale behind the significance of pharmacist's role, especially in primary care settings. As we know that in Asian countries and other middle-income countries, we are dealing with increased prevalence of non-communicable disease, but at the same time, we are still having infectious disease as the major burden for our healthcare. And reflecting on what we have been through during pandemic with mobility restriction, healthcare professionals in primary care facilities have become the first level of contact with the health system. In addition, the contribution of primary care health professionals, including pharmacists, have increased significantly because of more focus on disease prevention, health promotion, and involvement of primary care as the part of chronic disease management. We are pretty much aware of the shifting of pharmacy concept that pharmacy profession has evolved from its conventional and traditional drug-focused basis to advance a patient-focused basis over the years. So in the past century, that the pharmacists were more involved in compounding and manufacturing of medicine, but this role has significantly reduced over time. This advancement in the role of pharmacists called for the pharmacist to be the part of the broader healthcare team working for providing better healthcare for the patient. So the role of today's pharmacist needs to be expanded to include pharmaceutical care concept, making the pharmacist a healthcare professional rather than a drug seller. So there are some reasons highlighting the expanded role of pharmacy. There has been evidence that the success of patient treatment requires involvement of multidisciplinary healthcare professionals like doctors, pharmacists, nurses, could be physiotherapy, psychologists, and other professions. Pharmacists also have adequate knowledge about treatment management of a range of clinical conditions. And what makes pharmacists become so important is their accessibility. Patients do not need to make an appointment if they want to consult about their medication. Patients can just visit the pharmacist in their neighborhood. If we recall our memory during COVID-19 pandemic, hospitals were shut down, restricted for emergency care and for COVID treatment only. And people were afraid to go to hospital during that time. And during the very difficult situation, community pharmacists were the closest health facilities and probably the safest one to get medication and medical devices. Therefore, pharmacists are well placed to play a significant role in the care of patients in primary care. Now we look at the role of pharmacists in primary care. The roles are basically similar with other settings in which the pharmacist should balance their managerial role and their clinical service. Pharmacists should make sure, pharmacists should make sure the availability of medicine at any time. It will be a disaster if the medicine are out of stock. On the other hand, it will be inefficient. Pharmacists as a part of a healthcare professional are responsible to ensure the medicine received by the patient are the most appropriate one to support patient to improve medication adherence. So at the end, the patient will achieve the intended clinical outcome. And in the era of national health insurance, pharmacists have additional responsibility to control the healthcare costs because of the limited budget. And to standardize the pharmaceutical service in the primary care across Indonesia, our government has stipulated some regulation through Ministry of Healthcare decree. So this decree has become the guidance for all pharmacists to undertake two essential tasks. Firstly, to standardize in managing the supply chain of pharmaceutical inventories, including medicine, medical devices, and consumables like chemicals used for diagnostic. And this regulation will guide the pharmacists how to implement good practice in inventory management, starting from planning, procurement, storage, distribution, and documentation of each stage of the supply chain. And secondly, this decree also regulates the implementation of a range of clinical pharmacy services that will be explained shortly after this. Okay. Now we will look at the role that has been done for pharmacists. As we can see here that this slide pretty much provide the brief descriptions of the clinical pharmacy services that have been implemented in primary care, but some services might be applicable in certain settings. For example, here medication reconciliation can be implemented only in government-owned public health centers or clinics that provide inpatient services. Okay, the first role is MTR or medication therapy review. It's a comprehensive process in which the patients reporting all medication currently used to the pharmacist, including all prescription and non-prescription medicine. They also should report their herbal products and other dietary supplements that they are taking at the moment. Through the MTR service, the pharmacist may assess and then identify and prioritize treatment issues related to their medication and make some adjustment like doses or dose regimen, and also could provide recommendation about the contraindication or the side effects or other treatment-related problems. Implementation of MTR will allow the pharmacist to identify and resolve drug-related problems. Most of the time that solving drug-related problems require pharmacists to collaborate with other healthcare professionals, especially doctors. So to be able to successfully implement MTR, pharmacists should embrace pharmaceutical care process, which involve three major components: assessment, care plan, and evaluation. The assessment can be done if the pharmacists are able to collect adequate information about patient medication and their medical condition. The source of information may include patients and doctors. From assessment process, pharmacists can identify any problems related to patient medication and recommend care plan to doctors and patients to resolve the problem. After implementation of care plan, the output of pharmacist recommendation will be evaluated and adjusted based on the patient clinical outcomes. Okay, the second role will be providing education to patients. This interaction can be divided in three stages. Firstly, for the newly diagnosed patient, during this stage, the patients are overwhelmed already with their medical conditions, so pharmacists should limit the information. After patients take their medication for some time, patients can enter the second stage in which they should be knowledgeable about their medication, the importance of compliance, and the complication that may happen if their medical condition are not well controlled. And for patients with chronic condition, they will enter the third stage where the focus of the education will be around motivation and to empower patients to manage their treatment and self-care to support their condition like nutrition and healthy lifestyle. Okay, these are the content of education that pharmacists could provide. The most important thing is to consider the readiness and also the level of knowledge among patients that might be different. So the education could include about their disease process, the target of the treatment, and also could inform the patient about their medicine, the modalities, and then the healthy lifestyle, and then the prevention of treatment for complication. Most of the time, that provision of education may be not enough, and patients shows non-compliance and cannot achieve the goal of treatment. In this situation, pharmacists could offer medication counseling. So medication counseling is defined as service provided by pharmacists either through oral and or written information to address medication-related problems experienced by patients that may affect their attitude, their practice in taking their medication. It is a type of personal educational approach which is tailored based on patient need or patient concern that may differ from one patient to other patients. And the main goal of this service is to maintain compliance with treatment so patients can achieve treatment goal and improve their quality of life. Next is medication reconciliation. This clinical service is familiar actually in hospital setting. However, primary care providing inpatient service can also apply this service. So medication reconciliation is conducted to make sure the transfer of patient information will be running smoothly between healthcare professionals since patient admission to healthcare facilities during patient transfer within the same facility, and when patients are discharged from one facility to other facility or discharged to their home. So here from this figure, you can see that to do medication reconciliation need collaboration between patients and the healthcare facilities, hospital, community, clinic or pharmacies, and general practitioner. There are 3 steps in undertaking medication reconciliation. The first one, that pharmacists should take medication history to collect complete, comprehensive information on patient medication, either the prescribed medication, over-the-counter, herbal medicine, vitamin, or other supplement, in order to produce best possible medication history. So best possible medication history is a really important document for medication reconciliation. This document is then used by doctors when prescribing medication during inpatient, during transfer, as for example, from emergency care to inpatient care or to ICU, and also during discharge. So if any discrepancies are found between medication history and the current medication, so the discrepancy should be resolved immediately by pharmacists and doctors. Pharmacists also play important role in monitoring adverse drug reaction or ADR. So ADR is defined by World Health Organization as any noxious, unintended, undesired effect of drug that occurs at doses used in human for prophylaxis, diagnosis, or treatment. So globally, ADR is one of the leading causes of morbidity and mortality, and it will continue to pose a threat to public health as long as drugs are being used to treat various ailments. So that's why ADR remains the prime focus of pharmacovigilance activities. And being the most accessible healthcare professional, pharmacists' role in identifying, managing, and ADR reporting is very crucial in make sure drug safety in primary care setting. So in terms of reporting, in Indonesia, the reporting rate of ADR is relatively low. This is bad news actually compared to our neighboring countries like Singapore and Malaysia. And the problem of reporting, low reporting, is considered one of causes of delayed response in dealing with ethylene glycol contamination in children medicine last year. So Indonesia has special form for reporting called yellow form or form kuning meso. So any ADR event that happened or even the suspected one should be reported to our FDA, we call it BPOM. The pharmacists, the doctors, patient nurses can report ADR incidents either through digital reporting using a mobile app here, or they can report conventionally by sending up the yellow form to BPOM, Indonesian FDA. And the other clinical service that sometimes create controversy in the authorization of pharmacies to dispense pharmacy-only medicine. It is mentioned clearly in a Ministry of Health decree that pharmacists are allowed to dispense pharmacy-only medicine, or in Indonesia called obat wajib apotek, or simply called OWA. So OWA is a list of ethical medicine that can be dispensed by pharmacists directly to patients without doctor prescription, and the quantity of the medicine is restricted only for short-term use. It's around a 3-day supply of medicine. So in this service, the pharmacists to use their competencies and their clinical experience in practicing this service, and they should be aware that for some chronic condition require medical prescription for initial use. So the list of OWA may include oral contraceptive, antihistamine, and also the medicine for digestive problems like peptic ulcer, gastritis, and other medicine. Like asthma, TB, gout, and other conditions. So for information in Indonesia, we classify the modern medicine here in colors into obat bebas, free medicine, in which the patient or communities can buy it everywhere, not only in pharmacy, but also from any retailers. And we also have obat bebas terbatas with the blue color. So obat bebas terbatas refer to ethical medicine that can be purchased in pharmacy with special direction of use. We also have obat keras, the red one. For obat keras means a medicine that require doctor prescription, and the last one we have narcotics. And for herbal medicine, there are three classifications: is jamu, and then obat herbal standard. So to be categorized as obat herbal standard, the medicine should be tested preclinically. And the last one is phytopharmaca or phytomedicine. Okay, last but not least, home pharmacy care. So home pharmacy care is a clinical service provided by pharmacists in patient home to ensure optimal therapeutic outcomes can be achieved. Because of limitation in human resources, in this case, pharmacists to deliver the service, home care is prioritized for certain patients, like patient with complex condition, patient with multiple medication, or those with history of non-compliance, or high-risk patients that are prone to having drug-related problems. So home pharmacy care can be delivered by hospital pharmacists. It also can be given by primary care pharmacists. Okay, now we look at the way forward for pharmacists. Firstly, is medication therapy management, or MTM. This service have evolved as a means for pharmacists and other providers to assist patients and caregivers in improving treatment outcomes and also to reduce healthcare expenses. So MTM services are based on comprehensive personalized patient encounter that make use the pharmacist expertise in assessing complex drug regimen. So MTM include conducting comprehensive medication review, including all prescription, over-the-counter, herbal, and then the nutrition that patients are taking, and also include providing education and counseling to patients on their medication. And the third one is detecting and solving problems related to adherence to medication and to promote the appropriate use of medication. And the last one, to monitor the response to treatment and any occurrence of side effect. Okay, this slide describes the stages in MTM, starting from medication review. From the review, the pharmacist will identify the medication related problems and will create action plan to resolve the problem by undertaking collaboration with other healthcare professionals like doctors. Next, telepharmacy. This service is part of telemedicine. Through the use of telepharmacy health service, pharmacists can now reach a large number of patients. In addition to improving access to care, telepharmacy help improve health outcomes. Telepharmacy might include consultations on patient medication, also medication counseling, MTM, medication review, and program for patients with chronic disease like Prolanis in Indonesia. In our country, to be able to provide telepharmacy, healthcare facilities providing telepharmacy should be registered as provider of digital pharmaceutical service. This is the flow of telepharmacy. So the provider of telepharmacy, or in Indonesia we call PSEF, penyelenggara sistem electronic pharmacy, can dispense medication directly to patient for non-prescribed medicine and fill the prescriptions for medicine that require doctor prescriptions. This medicine will deliver to their home with delivery service like Gojek or Grab, or deliver directly by pharmacy as part of their service excellence. This service really benefit patients and our communities during COVID-19 pandemic as they were unable to go to hospital because of safety reasons. Okay, the other future for pharmacists, but probably not in the near future, is prescribing pharmacies. This service has been running in few countries like UK, Canada, but in Indonesia, it is not considered legal yet. So prescribing pharmacy will have authority like doctor to diagnose and prescribe medicine. And this requires pharmacy to have really advanced expertise to implement this practice. Okay, this brings me to the last part of my presentation, and thank you.
Thank you so much, Mrs. Hesti Utami Ramadaniati, for the amazing material that has been conveyed very well. As always, we would like to do the discussion session after the materials have been presented. For all the participants who would like to ask our speakers, please write down your questions in the Q&A box with the format name _ speaker 1 or 2 _ question.
Moving on to our most awaited segment, which is the discussion session. For participants who would like to ask our speakers today, can write down the question in the Q&A box below, again with the format name _ speaker 1 or 2 _ question. Let's wait for some questions first.
You can ask any question, even the simple one, that's okay.
Suraya, will you be asking the question?
Yeah, I'll be reading it out for you. So here, Putri Inshira would like to ask Dr. Hesti, can I know how can ADR reporting be increased, since you did tell us that there was a decrease in numbers of reporting?
So I answer straight away or waiting for the other questions?
Since we don't have any other questions yet, I think you can answer it first.
Yeah, because ADR reporting is done by two parties. The first one is from the healthcare facilities and the second one from pharmaceutical industry. At the moment now in Indonesia, it is mandatory for pharmaceutical industry to report any IDR. So the reporting rate is quite high. But the problem is with the healthcare facilities, it is still voluntary. It is not mandatory. As we know that the healthcare professionals are very busy with their service, so sometimes they identify the ADR, they collect the IDR, but they don't have time to report it. So if we want to increase the reporting rate, we have to make it compulsory for professional in healthcare facilities. That's my...
Can I add something? Yeah.
Yes, sure.
So, Doctor, in addition to what happens in Malaysia under MADRAC, Malaysian Adverse Drug Reaction Committee, is apart from the healthcare and industry reporting, they have come up with a system called Conserve, which means that the consumer is now able to also report ADR, which is something quite, in a way, a big wake-up call for industry and pharmacists. Thank you. Okay.
So to clarify, the answer would be to make it compulsory from Dr. Hesti and also from Madam Dr. Mariani. It would be to ensure that consumers are able to report to.
Yeah, that's the system we have in Malaysia.
Right. Thank you. So, Adiba, second question.
Yes, it seems that there are many questions. Our participants are very active today. The second question would be, Prof. Hesti, I would like to ask, how can collaboration between pharmacists and other health professionals strengthen the role of pharmacists in primary care?
For me?
Correct.
Okay. How to strengthen the role of pharmacists? Is it?
Yes.
Yes.
How can collaboration between pharmacists and other health professionals strengthen the role of pharmacists in primary care?
Yes, actually, the role of the pharmacist it has been very clear in primary care setting in Indonesia. We have the regulation already, but here it really depends on the pharmacy itself, whether they want to be brave enough to collaborate with doctors, especially in primary care. Because sometimes they're not confident enough with their expertise. They just prefer to behind the dispensary. They don't want to meet with the doctors. But in hospital setting, pretty much because they have a regular visit with the doctors, they have discussion with the doctors. So the opportunity is open quite widely for those in the hospital setting, but quite limited in primary care. But it is not impossible for them if they want to start by having communication with doctors. So it really depends on the pharmacists because the regulation has allowed them, to have collaboration with other healthcare professionals.
Thank you so much, Professor Hesti.
The next question would be from Sean for Dr. Mariani. What are the roles of pharmacists in online medication purchasing in terms of self-medication?
Well, currently in Malaysia, we have many what we call electronic platforms. So at the moment, most of the medicine that we want to self-medicate with, the consumer can actually purchase non-prescription items through the pharmacy portal, through the pharmacy platform. That's legal. But for the prescription medication, there is an added protection where they have to actually get an e-prescription from a registered doctor, and even the signature is actually all organized and handled by a separate entity. So there's a lot of control. So it is happening now where they even have delivery of medicines, just like our Indonesian colleague mentioned, that there are delivery services by all the normal e-delivery channels. Okay.
So to summarize, would that mean the pharmacist would be managing all of the process before the medication is received to the patient?
The pharmacist actually will be preparing the medicine at the pharmacy, and then the delivery will happen.
Thank you, Datin.
The next question is for both Professor Hesti and Mrs. Datin. From what has been said, there are similarities, namely wanting to maximize the potential of pharmacists both in Indonesia and in Malaysia, especially those from Pancasila University and Cyberjaya University. What I want to ask is what should be instilled in current pharmacy students so that when they graduate, they become graduates who are maximized in terms of service so that they can have a positive impact on society, especially on health.
Okay. Is it for me? Okay, can I answer?
Yes, of course.
Okay. Thank you for the question. Going back to what our esteemed colleague from Pancasila mentioned, I would say that in order to deliver services, it's all about wanting to. And I think one of the important areas to embed in the curriculum is actually interprofessional learning, because most of the time we have the knowledge and even the skills, but the added skill that is needed is probably the skill of collaborating with others, meaning get very friendly with the curriculum of interprofessional learning, working with other healthcare professionals like your medical students, so that in future, when you want to work, you will be very comfortable with medical doctors and specialists and other healthcare providers. Okay.
Yes, if I can add that actually all the knowledge required by pharmacists have been facilitated through our curriculum. And then when they enter the pharmacist profession program, it is the opportunity for them to collaborate with other healthcare professionals, to have interprofessional education and communication. That's, I think, the best time for them to practice, to get the experience.
Thank you very much.
Next question will be from Fatima Alia for Dr. Mariani. She will be asking how to take care of ourselves and our mind to keep it sane during this situation as a final year pharmacy student.
I feel you. So I think that our counterparts in Indonesia and also Malaysia agree that the pharmacy curriculum is very, very tough. You know, I always say that you have to take care of yourself first. So please have a great hobby. You know, somewhere you can run away, or not to say run away, but you can definitely enjoy your own time to love yourself, to be with yourself, enjoy what you're doing. And please have a strong support group, like talk to your family and your friends about what you're going through, because life is going to be even more tough when you start working. So my advice to you is find good coping mechanism. Okay.
Agree.
Thank you, Datin. Surely, Fatima Alia, we will find a hobby that can reduce our stress in this pharmacy student life.
Actually, there's still some more questions, quite a bit actually. Do we still have time for discussion session?
Yeah.
Okay, so the next question is from Teddy Himawan. For Mrs. Hesti, a little out of topic, but I would like to ask, what are the differences between comprehensive medication and precision medication, and how is it applied in Indonesia?
Okay. Okay, although it is a bit off topic, but I will try answer as best as I can. So the precision of medicine is targeted medicine. So it's not like the conventional medicine, like we are not targeting anything, any receptor, but the precision medicine, we are targeting special receptor. And it had this kind of medicine have been used in Indonesia, especially for cancer patients. So it is around already, but only limited for certain condition. But the comprehensive medication is the medication used for all medical condition that patient have. So they have the comprehensive one, like if they have hypertension, they have the medication for that. And if they have diabetes, they have medication for that. But all the medication received by the patient should be rational. It doesn't mean that all medical conditions need to be treated, but the doctors will consider what medical condition that require medication, what other condition that probably the patient do not need any medication at all. So that's my opinion, actually.
Thank you very much. Actually, Soraya, I think we have one more question. Do you want to read it?
All right, I'll read out the last question. So from Francis, it would be towards Dr. Mariani. Okay, the same drug can come in many brand or generic. What should we recommend to patient, the generic drug or branded? Because quality of generic drug generally lower than branded, but it is cheaper.
Okay, thank you for the question. So this is where I will say that pharmacists are also very good accountants. We are actually prided in the Ministry of Health for keeping our cost of drugs down. You have to ask yourself, this patient is in which setting? Is it in the payer setting, or is there a third party payer, or is the patient paying themselves? So we know that all generics have to actually be registered very rigorously through the National Regulatory Agency. And I think that the safety of the quality, safety, efficacy of generics is very good. So you have to take into account the patient's socioeconomic background, the economic background, because if they are paying themselves, say for long-term treatment, the generic drug may be very, very cost saving. Okay, because what we want is medication adherence, continuity. If the medicine is for short-term or acute care, it may be a different story. For example, antibiotics. Antibiotics, you definitely want a very effective, and that's where sometimes people want to have the original. Okay, so it's very much dependent on the setting and the background of the individual. Okay, thank you.
Thank you, Datin. So for us to choose, we have to consider a lot of factors. So thank you so much, Ms. Datin Dr. Marani Ahmad Nizaruddin and Mrs. Hesti Utami Ramadhanati for answering the questions. We would like to invite Ms. Fanny Alvina Fidelia as the Chief Committee of International Webinar Collaboration Sema Ff-Kmup and Cyberjaya University Pharmacy Student Society to hand out the souvenirs for Ms. Datin Dr. Marani and Ms. Hesti Utami Ramadhanati.
Allow me to take the picture. And 1, 2, 3. Thank you.
Thank you, committee.
Thank you very much. Do we do a group shot? No.
We will have a group photography session at the end at around 2:30. But would you like to take a spontaneous one right now?
If possible, yeah. Is it okay, doctor? Yeah.
Documentation team?
Sure, why not?
Thank you.
All right, documentation team, are you guys okay with taking screenshots?
Yeah. Okay.
Okay, thank you.
Allow me to take another picture. And 1, 2, 3. Thank you.
Thank you so
Excuse me,
much.
Can we take another one without the certificate background?
We can.
Yeah, again, without the certificate background with everyone in it, hopefully, if you can.
But allow me to take another picture. And 1, 2, 3. Thank you.
Thank you. So thank you to Miss Fanny Alvina Fidelia, Ms. Datin Dr. Marani, and Mrs. Hesti for your time.
Thank you. Well done.
So that sums up our discussion session. Now, ladies and gentlemen, let's move on to our next agenda, which is an introduction video presentation from Faculty of Pharmacy, Cyberjaya University, and Faculty of Pharmacy Pancasila University. Here, we show an introduction video about Faculty of Pharmacy Cyberjaya University. Enjoy!
My name is Nurdiana. I've been in the pharmacy academic industry for the past almost 15 years, and I've been here at the University of Cyberjaya, Faculty of Pharmacy, for the past 10 years. I would say that at the university, at the Faculty of Pharmacy, we focus on producing students that are ready to practice upon graduation. So we equip them with many skills, hands-on experience, so that when they graduate, at whichever workplace that they want to venture into, they are able to practice effectively, to give care to the patients and also give back to the profession. At the University of Cyberjaya, our motto is nurturing the passion to care. And we start that from when we train our students themselves. They are encouraged to value their feelings or put a label to their feelings so that they can better empathize to the patients that they're treating one day. So we do this with a module called Affective Domain, and here students are encouraged to take charge of themselves with self-management skills, communication skills. So we believe that these skills are what would prep them to be a better healthcare worker in the future.
Okay, my name is Dr. Liu Kai-bin. I'm an assistant professor teaching in University of Cyberjaya. Basically, I'm teaching the subjects in pharmaceutical technology about formulation, about how to produce a product. Pharmacists actually play a very important role in ensuring safe, effective, and quality drug products are delivered to the patients. So by working together with other healthcare professionals, pharmacists are able to provide accurate advices and recommendations about medicines to the healthcare team and also the patients. Being a relatively young university, UC is considered doing very well in building up the research culture and also increasing the research output from year to year. We have research club meeting, research workshop that enable the researchers to share their experience, exchange their knowledge, and very soon we are going to have our own UOC scientific journal as well. UOC has a bunch of very experienced lecturers in various fields of pharmacy, and we, the lecturers here, are always ready to help our students to share our knowledge and experience with the students, and also to help them to excel both in academic and core curriculum activities.
My name is Masur Muhammad. I'm one of the lecturers at the Faculty of Pharmacy, and I'm currently the Year 1 coordinator for the program of Diploma in Cosmetics. We have a number of other common labs as well, like the pharmaceutical compounding lab, where they will basically do formulation. Most importantly, the graduate of this program will have a deep knowledge, foundation knowledge, the science behind cosmetics. Yeah?
My name is Rand Omar. I'm a pharmacy student and I'm from Iraq. I saw how attractive the curriculum is of pharmacy in University of Cyberjaya. I thought it's for sure for me. So the lecturers are always there for you to answer any concerns and any questions. That's of course academia-wise, but also something we have in our pharmacy course is called Affective Domain, which is AD. This helps you to connect with your mentor, and you can mention your emotional worries, your mental worries. So it's not just academic, but they also look for you in your emotional and mental side.
I think in high school I used to show great interest in biology and chemistry. So I did some research on what degree course I could pursue after SPM, and I finally came across pharmacy. I think what excites me about chemistry is that although it's not something I can see with my naked eyes in terms of the atoms and everything, but I find it really easy to understand. So I think that's what excites me the most. So during the open day, I talked to some of the students, and they helped to explain me what goes on in University of Cyberjaya, especially in pharmacy. And I think from there, it really intrigued my interest to be a student here. The lectures here are very helpful. Like in class, they'll make sure you understand everything that they're saying. And apart from that, when we have our tutorial sessions, they will actually ask extra questions just to enhance our understanding even more.
Here we have all the equipments and materials needed, and then the setup of the labs makes it easier for us to do practical lab sessions to prepare us for industrial training. The lecturers here are very friendly and approachable. They've always welcomed me, and if I have any difficulties, whether it be personal or assignment related, they've always never refused to answer any of my worries.
All right, amazing video. Give it up for Cyberjaya University. Next up, we'll see the video from Faculty of Pharmacy, Pancasila University. Hope you all enjoy the video.
Growing together with Pancasila University, Faculty of Pharmacy, seizing achievements for the country. Pancasila in the Pancasila University name is not just an identification and differentiator, but has an essential depth of meaning in accordance with the mission it carries out. Providing a positive role in the development of science and technology, as well as the development of Pancasila-based society as aspired to in the preamble to the 1945 Constitution. Pancasila University desires to produce graduates who have the spirit of Pancasila, have values and attitudes, knowledge, intelligence, skills, and communication skills, and support development and uphold the value of education. As a form of commitment to implementing the noble values of Pancasila and strengthening religious tolerance, Pancasila University built 6 houses of worship in the middle of the campus environment, namely the At-Taqwa Mosque, Kebajikan Agung Temple, Gereja Protestan Christian Service Graha, Santo Petrus Catholic Church, Widya Santika Temple, and Dharma Sasana Vihara. In its participation in the field of health development, Pancasila University has a faculty of pharmacy, and this is a real manifestation of a pharmacist for society. As the first and biggest private pharmacy faculty in Indonesia, it has a vision to be a pioneer of superior pharmaceutical higher education at the national and international levels, serving the interests of the nation and humanity imbued with Pancasila. The Pancasila University Faculty of Pharmacy is committed to being superior in the implementation of education, research, and community service, to produce experts and professionals in the pharmaceutical field who have a noble character and a global insight. As the world of education develops, the Pancasila University Faculty of Pharmacy continues to grow and have 5 study programs, which are Diploma 3 in Pharmacy with Accreditation A, Bachelor of Pharmacy with Accreditation A, Profession Pharmacist with Accreditation A, Masters in Superior Accreditation, and Doctoral in Pharmaceutical Science with Excellent Accreditation, with alumni spread all over the country and also foreign countries. Until 2022, the Faculty of Pharmacy has been able to graduate more than 13,000 graduates of Associate Pharmacy Experts, Bachelor of Pharmacy, Professional Pharmacist, Master of Pharmacy, and Doctor of Pharmacy. The Faculty of Pharmacy in Pancasila University applies the student-centered learning, problem-based learning, project-based learning, and outcome-based learning models that support up-to-date and reliable learning processes. The development of learning models are applied to produce superior and exceptional pharmaceutical graduates. In supporting the development and progress of the pharmaceutical world, the Pancasila University Faculty of Pharmacy has been supported by complete facilities and infrastructure, such as the Pharmaceutical Technology Laboratory, Pharmaceutical Chemistry Laboratory, Educational Pharmacy, and laboratories. The Pancasila University Faculty of Pharmacy is equipped with a CBT Center and OSCE Center to support the competence development of the pharmacist profession. This facility was built to support the learning system and final exam for pharmaceutical graduates who are competent in the pharmaceutical world. In the field of literature, the Pancasila University Faculty of Pharmacy has a library that has been established since 1976. It was expanded with the inauguration of a new 2-floor building with an area of approximately 486 meters square, which was named the Sunarto Prawiro Suyanto Library in July 2009. The world has recognized pharmacy as a great profession in serving humanity. Like the Pancasila University Faculty of Pharmacy has a great responsibility, like the Pancasila University Faculty of Pharmacy that has a great responsibility and contribution to produce graduates who are competent in the world of pharmacy. The world of pharmacy is growing from the hand of the best graduates who have been developed. Growing together with the Pancasila University Faculty of Pharmacy.
Brilliant video presentation. Give it up for Pancasila University. Wow, what an amazing collaboration between two amazing universities. So, Soraya, what did you think about the video?
It was great. So, Adiva, do you enjoy studying at Pancasila?
Yes, I enjoy studying at my campus. Actually, it was my very first choice when I wanted to get into pharmacy. Now, let me ask you the same thing. Do you enjoy learning at Cyberjaya University?
Yes, I very do. I love the environment. So, before we go for anything else, now we will be having our break time. We will be given a 30-minute break and resume activities at 12:20 waktu Indonesia Barat for Indonesian participants and at 1:20 for Malaysian time for Malaysian participants. Participants are allowed to turn off their camera and are expected to stay in the Zoom channel. Thank you.
Happy breaks, everyone.
Recording stopped. Recording in progress.
Hi, welcome back everyone. How was your break?
How was everyone's break? Welcome back.
I hope everyone had their lunch.
Hope everyone prayed and eat. Because after this, do you know what we're going to do after this, Soraya?
Not sure, what are we gonna do?
So before we actually get into our next agenda, let's chill down for a bit. Like, chill down. We just went back from break. And I hope
Biru?
everyone is taking care of their health because it is flu season. Everyone is getting sick. Especially here in
Hot and cold
Jakarta.
here. Oh, really?
Yeah. Did you know? Since beginning of August, I think, everyone's just been getting the flu.
What about you?
Me
Did you get
too.
the flu?
Yes. If you couldn't hear my voice is a little tangly. I hope nobody noticed. So I just told everyone, but that's okay.
No, you're perfect. Don't worry.
Thank you. Oh my God, thank you. Make it cool.
So the next part will be the cultural odyssey. So actually, what is it about?
Okay, so I will be answering your question. Now brings us brings us to our next segment, that is the Cultural Odyssey. The Cultural Odyssey is an activity to introduce the culture of each country, which aims to enable participants to learn and interact with other cultures. It is hoped that the participants will enter the breakout rooms that the committee has provided according to the group.
Recording stopped.